Candace Jones. I'm a nurse practitioner and health coach, and I am the owner of Faith Collaborative Health, where we provide healthcare at home on your schedule. We offer coaching and we also offer urgent care services in the early mornings and evenings. Today, I am going to be talking about a really important topic. It's a very common condition, and that is that of prediabetes. So, a lot of people don't realize that they are pre-diabetic. As a matter of fact, 4 out of 5 people who have pre-diabetes are walking around and don't even know that they have pre-diabetes. So why is pre-diabetes so important? You've probably heard of diabetes, which is the big bad awful disease that can affect every organ in your body. But why is pre-diabetes so important? Pre-diabetes is so important because it is actually reversible. So if we can get things under control with lifestyle changes, then a lot of times we can prevent pre-diabetes from becoming actually diabetes. So there's a test that your doctor should be doing. The ADA has now decreased the screening age for diabetes from age 45 to age 35. I think that happened last year. So if you're over age 35, you should be screened for pre-diabetes. That is a simple blood test, a little finger stick or blood draw, where we look at a number called a hemoglobin A1C. Now, what that number does is it gives us a snapshot of the last 3 months and kind of what your blood sugars have been doing over the last 3 months on average. So if your number comes back between 5.7 and 6.4, that means that you're pre-diabetic. Anything above that, 6.5 and above, is diabetic, and anything below that, 5.6 and below, is considered normal. So we know that when you're above 6.5, your average blood sugar range is going to be around 140 or over 140, and that means that you are diabetic if we get that number on 2 occasions. So we're not going to judge you and label you diabetic on your first lab work, but if you consistently have 2 numbers over that 6.5, then you do qualify as a diabetic. So why is this so important? Even pre-diabetics can have damage to their heart. You have an increased risk of stroke. Your blood vessels can be damaged, your nervous system can be damaged, and your kidneys can be damaged, as well as your eyes, even prior to getting to that stage of diabetes and that label of diabetes. So it's so important because when you're in the pre-diabetic phase, a lot of times it can be reversed and actually prevent you from going into diabetes, or at least lengthen the amount of time before you go from pre-diabetes to diabetes. So who's at risk for pre-diabetes is those that are, as we get older, we become more at risk. So above 35 is when we should start screening according to the ADA. If your BMI is greater than 30, so your body mass index, if you're overweight or obese, you're going to be at a higher risk of prediabetes. If anybody in your family has a history of diabetes, then you'll be at higher risk than the average person for diabetes. And then if you don't get in at least more than 3 times of exercise or physical activity per week, then you're at increased risk. And for women, if you had gestational diabetes, then you're at increased risk for developing diabetes down the road as well. So why am I taking the time to hop on here and give you all this information today? Is to encourage you, because we know that 4 out of 5 people that have it are walking around and don't know it. It's something that you should be screened for if you're over age 35, or if you fall in any of those other risk factors that we just talked about. Also, it affects somewhere between 88 to 96 million people. So that is a ton of people walking around with pre-diabetes, and 8 out of 10 don't even know that they have a problem. These people develop blockages. These are people that can develop silent heart attacks, sudden onset strokes, things that they don't even know that they have, or they show up one day and they get a routine blood test at their doctor's office and they realize that they now have chronic kidney disease because they didn't realize that they had all of this silent prediabetes going on. What are some of the symptoms of prediabetes? It can be very similar to when you're diabetic. So weight gain, fatigue, more increased appetite, increased thirst. You a lot of times are going to the bathroom more frequently, or like a lot of people, you may not notice any changes at all. Some people say they've noticed their vision can be a little bit blurred, but again, a lot of people are walking around and they're not really noticing any significant symptoms, other they might say, oh, I've been a little more tired than usual. So long story short, if you have not been screened for prediabetes and any of those conditions, and you meet any of those conditions, I would say go ahead and be screened. Now, we can do that as part of your health coaching here at Faith Collaborative Health. So if you're interested in getting healthier, in looking at ways that you can tap into your lifestyle and find out how you can be the best, healthiest version of you, ward off some of these diseases that are preventable with changes in lifestyle. We help you manage your stress, manage your diet, manage your education, so that you know what you need to look out for and what you need to be working towards to stay healthy and to live your best life. So if you have any questions, feel free to reach out to us, faithcollaborativehealth.com. You can call us, text us. Our number's on the Facebook page, Instagram, as well as our website. So we'd love to hear from you. Go get your screenings and take care and be healthy and be well. Thank you.